Hello, and welcome to QuickTale English. Today, we share a true medical mystery from 1994, a shocking story about chemical reactions and unknown dangers. The Toxic Woman of Riverside. It was a cold evening in February 1994 at Riverside General Hospital in California. The emergency room, ER, was quiet. Nurse Julia was working the night shift. She was an experienced nurse, calm and professional. She knew the hospital well. Dr. Susan was also there, a young doctor who was learning fast. They were drinking coffee and talking quietly. At 8:15 p.m., the quiet evening ended abruptly. An ambulance arrived quickly with a critical patient. The patient was a woman named Mrs. Gloria. We will call her Mrs. Gloria in our story. She was only 31 years old. Mrs. Gloria was severely ill. Her heart rate was very fast, and her breathing was shallow and quick. She was confused and in deep pain. The medical team quickly moved Mrs. Gloria from the ambulance to the trauma room. Nurse Julia immediately started working to help stabilize the patient. Dr. Susan examined Mrs. Gloria's pale skin. As the team worked, they started to notice things that were very unusual. First, Mrs. Gloria's body seemed strangely moist. There was an oily sheen on her skin. Second, a terrible, strange smell began to fill the room. It was not the normal hospital smell. It was a chemical odor, like sweet fruit mixed with something metallic or garlicky. It quickly became overpowering. "Do you smell that?" Dr. Susan whispered to Nurse Julia. "It's like bad perfume and something else. It's too strong." Nurse Julia nodded, focusing on the patient. "It is strange, but we must work fast. Her heart is failing." Dr. Susan decided they needed to take a blood sample immediately to check for poisoning or an internal problem. Nurse Julia prepared a syringe and carefully drew blood from Mrs. Gloria's arm. This was the exact moment when the simple medical procedure turned into a horror. Nurse Julia pulled the syringe away from Mrs. Gloria's arm. She noticed something shocking in the dark blood inside the tube. Small white crystals were floating there. The crystals looked like tiny pieces of white sugar, but they did not dissolve. They were clearly visible. "Dr. Susan, look," Julia said, her voice shaking slightly. "What is this? The blood has things floating in it." Dr. Susan leaned in to look at the tube. The moment she was close to the blood sample, she felt a burning sensation in her throat. Her eyes began to sting. Before Dr. Susan could react, Nurse Julia suddenly cried out. She stepped back, clutching her head. "I feel burning. My head is hurting so much. I cannot breathe." Nurse Julia immediately collapsed onto the floor. She was unconscious. Dr. Susan shouted for help. Two more nurses and another doctor rushed into the room. They tried to move Nurse Julia, but as they entered the small room, the strong chemical odor immediately affected them too. The other doctor, Dr. Cohen, tried to help Julia, but he also felt very dizzy. Another nurse, Nurse Sally, who was trying to help, felt her legs weaken. She reported feeling like her face was burning. Then Nurse Sally collapsed too. The alarm was raised throughout the entire emergency room. The staff understood that the patient, Mrs. Gloria, was emitting some kind of toxic invisible vapor. They quickly pulled the remaining staff out of the room and closed the doors. The trauma room was now a containment area. In total, 23 medical staff members had symptoms, and 6 were hospitalized with severe problems: respiratory failure, severe headaches, and temporary paralysis of the legs. Nurse Julia was the most affected. She spent 2 weeks in the hospital with serious breathing problems. Mrs. Gloria, sadly, died that night. But the mystery of the poison had just begun. The hospital called the fire department and a special chemical investigation team. a HAZMAT team from the outside. The entire emergency room was isolated. The HAZMAT team, wearing specialized protective suits, entered the trauma room. They tested everything: the air, the equipment, the walls, and the clothes. The results were the first mystery. They found no external gas leak. They found no chemical spills on the floor. The source of the toxic vapor was not the hospital. It was Mrs. Gloria's body itself. The medical examiners took Mrs. Gloria's body to a special laboratory for a full autopsy. They searched for illegal drugs or known poisons, but found none. But then the scientists found strange chemicals in her blood and tissue that did not belong there. They found several unusual compounds, including one called dimethyl sulfone, DMS. DMS is an organic compound, and it is usually harmless. But the quantity in Mrs. Gloria's system was very high. The scientists developed a theory which was complex but simple for the general public. Mrs. Gloria might have been using a special cream or a natural remedy that contained a substance called DMSO, dimethyl sulfoxide. DMSO is sometimes used as a treatment for pain. If DMSO was in her system in a high amount, combined with the efforts of the doctors to revive her, especially the oxygen and electric shocks, a very rare and complex chemical reaction could have started inside her body. The theory suggested that the high levels of DMSO turned into the chemical DMS. Then the scientists theorized the DMS could have broken down further, creating a highly toxic, invisible gas, perhaps dimethyl disulfide or dimethyl trisulfide, that affected the medical staff when they were close to her blood. This chemical reaction essentially made her body a small, temporary toxic gas factory. However, the final cause of Mrs. Gloria's death was kidney failure, but the mystery of the toxic vapor was never fully proven. The official report said the cause of the staff's illness was unexplained. The investigators never definitively proved the DMSO DMS theory. They never found the exact gas. The strange odor, the oily sheen, the white crystals, and the immediate collapse of the nurses remained one of the biggest unsolved medical mysteries in history. The case of Mrs. Gloria, the woman whose body briefly became a chemical hazard, is still studied today. She is simply known as the Toxic Woman of Riverside. Thank you for joining QuickTale English. Subscribe for more spooky stories and medical mysteries, and continue practicing your B1 English. See you next time.